A contagious disease outbreak may affect only a few animals, herds, or flocks, or it can quickly spread to many. When a disease is spreading rapidly, we call it an epidemic. Intense efforts are often required to control or stop it. The three main ways to contain an epidemic are: 1. Rapid detection through surveillance and reporting. 2. Prevention or mitigation by taking actions to decrease disease exposure. And 3. Removal of susceptible animals by death, recovery, or vaccination. Rapid detection means you recognize when a disease is present and confirm the cause as soon as possible. If you see unusual illness in one or more animals, or a drop in production at the herd level, ask a veterinarian to run diagnostic tests. It's essential to stay observant and immediately report any signs of disease. Sometimes testing can find disease before signs of illness appear, which helps contain the outbreak before it spreads further. Any delay in detection means more animals will become infected. Mitigation methods can help slow and contain an epidemic. These include limiting or stopping animal movements, employing cleaning and disinfection practices for people, equipment, and vehicles, and restricting farm traffic. The latter is one of the most effective ways to reduce the spread of disease. But mitigation is only effective if it's implemented before animals are exposed or the disease spreads, and is most effective when done conscientiously. The final way to contain an epidemic is by removing susceptible animals that could become infected if exposed to a disease. Susceptibility depends on several factors, including the animal's immune system, previous exposure, and vaccination status. Newborn animals are susceptible, and so are those whose natural or vaccine-induced immunity no longer protects them. Susceptible animals are removed from a population when they develop immunity after natural exposure, develop immunity after vaccination, or die of disease or any other cause. Animals can develop natural immunity to a non-fatal disease through previous exposure. Vaccine-induced immunity is specific to a disease, but can take weeks to develop and is usually stronger after a booster shot. However, a vaccine might not exist or take effect quickly enough to fight a quickly spreading outbreak. When necessary, culling or depopulation of infected, exposed, and potentially susceptible animals is done according to animal welfare guidance. Removing animals before they become infectious can limit how many others get infected and shorten the length of an outbreak. We'll discuss this further in another video.